Hey everyone, and welcome to this Clinical Explainer. Whether you're a nursing student gearing up for exams, a seasoned healthcare pro brushing up on the basics, or honestly, just someone fascinated by how the human body works, you are definitely in the right place. Today, we're going to break down the complex anatomy and the absolutely vital physiology of the human kidneys. We're going on a complete macro-to-micro journey, starting with where these organs sit in your body, zooming all the way down into the microscopic factories that literally keep you alive, and tying the whole thing together with some crucial clinical tips. All right, let's jump right in. We've got 5 key areas on the agenda today. We'll start with the 7 functions of the kidneys, move into the urinary system anatomy, explore the structure of the nephron, break down the 3-step urine formation process, and wrap up with glomerular filtration and the RAS cascade.
So, Section 1, 7 functions of the kidneys. Because, as you'll quickly see, they handle so much more than just the body's garbage disposal. To really grasp total body homeostasis, we have to look at the big picture of what the kidney actually manages. Now, if you're a nursing student, you're going to love this classic mnemonic. It's a fantastic mental hook. A wet bed. A is for acid-base balance. Your kidneys are constantly working to keep your blood's delicate pH right between 7.35 and 7.45. W is water balance, tweaking your urine volume based on how hydrated you are. E is electrolyte balance. We're talking sodium, potassium, calcium. T is toxin removal, filtering out all that water-soluble waste. B is blood pressure control, which is huge, and we'll dive deeper into that later. The second E is erythropoietin production, which is a hormone that actually tells your bone marrow to make red blood cells. And finally, D is vitamin D activation, converting it into calcitriol for bone health. So when you look at it like this, it's pretty clear. If the kidneys fail, every single one of these vital systems goes right down with them.
Okay, now that we know the why behind what they do, let's hit Section 2, Urinary System Anatomy. Let's physically locate these incredible filters.
Picture this in a realistic 3D space inside the body. The kidneys are 2 bean-shaped organs roughly the size of a large bar of soap. They're located retroperitoneally, which is just a fancy way of saying they sit tucked behind the peritoneum right up against your posterior abdominal wall. They span from your 12th thoracic vertebra down to your 3rd lumbar vertebra, which gives them a nice little bit of physical protection from your lower ribs. Clinically speaking, it's a good tip to remember that the right kidney actually sits slightly lower than the left one. Why? Well, because the massive right lobe of your liver is hogging a lot of space right above it.
Now, once the kidneys manufacture that urine, it doesn't just passively drop by gravity. It travels down the ureters, which are these 2 slender muscular tubes about 25 to 30 centimeters long. And they actively transport the urine down to the bladder using peristalsis, the exact same way your digestive tract moves food. Then, the urinary bladder steps in as a temporary storage tank. And here's a fun fact. When the bladder fills up with about 200 milliliters of fluid, these little stretch receptors in the bladder wall fire off signals straight to your spinal cord. That's what gives you that sudden, unmistakable, I really need a restroom right now feeling. Finally, the urethra carries the urine out of the body.
All right, let's shift gears from the macro view and zoom way in for Section 3, Structure of the Nephron. Welcome to the microscopic factories. The nephron is the fundamental structural and functional unit of the kidney. Literally, this is where the magic happens. You have over 1 million of these little microscopic factories packed into every single kidney, and they are tirelessly working every second of your life to filter your blood, balance your electrolytes, and create urine. Let's break down the plumbing of this microscopic factory. It all starts at the renal corpuscle, which is basically a super tight knot of capillaries called the glomerulus, tucked perfectly inside a cup-shaped structure known as Bowman's capsule. Once fluid gets filtered out of the blood right there, it enters a series of tubes. First up, the proximal convoluted tubule, or PCT. Then the fluid takes a steep dive down into a hairpin turn called the loop of Henle. It comes right back up into the distal convoluted tubule, the DCT, before finally emptying into a collecting duct, which gathers urine from a bunch of different nephrons at once.
Now, it's really important to know that not all nephrons are exactly the same because their structure totally dictates their function. The vast majority of them, about 85%, are cortical nephrons. Just like it sounds, they live mostly out in the outer cortex of the kidney, and they have these fairly short loops of Henle. Their main gig is reabsorbing nutrients and excreting waste. But the other 15% are your juxtamedullary nephrons. These guys sit right on the border of the cortex and the medulla, and they feature these incredibly long loops of Henle that plunge deep down into the medullary tissue. That physical depth is absolutely crucial. It lets them act as a countercurrent multiplier, which creates this massive salt gradient. Basically, that's what allows your body to concentrate your urine and save water when you're dehydrated.
So we've got the anatomy down. Let's move to the actual physiology. In Section 4, the urine formation process. How do these little structures actually filter the blood? Converting blood plasma into true urine happens in 3 distinct sequential steps. Step 1 is glomerular filtration, and this is purely a pressure game. High blood pressure essentially forces water and small solutes out of the glomerulus and straight into Bowman's capsule. But step 2 is tubular reabsorption, because hey, we don't want to pee out all the good stuff we just filtered. So as that fluid travels through the tubules, mostly the proximal convoluted tubule, the body works hard to actively and passively grab the water, glucose, and ions it needs and pulls them back into the bloodstream. Finally, step 3 is tubular secretion. Think of this as the body's final sweep. It pushes undesirable wastes, excess potassium, hydrogen ions, and even certain medications from the blood directly into the tubule fluid, mostly happening over in the distal convoluted tubule. Now you want to talk about efficiency? The numbers here are absolutely wild. To put this in perspective, your kidneys filter a whopping 180 liters of fluid every single 24 hours. Just let that sink in for a second. 180 liters. But you only actually excrete about 1 to 1.5 liters of urine. That means your body is reabsorbing over 99% of that water right back into your blood. And look at the glucose. 180 grams get filtered, but in a healthy person, there is 0 grams in the urine. None. Because the body completely reabsorbs it. It perfectly highlights just how hard those tubules are working. All right, for our 5th and final section, we are going to zoom back out and connect all this micro-level filtration back to your full-body homeostasis. Section 5, glomerular filtration and RAAS. 125. If you're heading into the clinical world, burn that number into your brain. 125 milliliters per minute is a normal glomerular filtration rate, or GFR. That's the total volume of plasma getting squeezed out of the glomerulus and into Bowman's capsule every single minute. And that specific rate relies completely on maintaining a very precise net filtration pressure, basically about 10 millimeters of mercury continuously pushing fluid out. To make sure the filtrate is perfect, your blood has to pass through what is essentially an intense 3-layered microscopic VIP bouncer system, called the glomerular filtration barrier. Layer 1, the fenestration pores. These are tiny little windows in the capillaries that let the small stuff through but completely block the big guys like red and white blood cells. Layer 2, the basement membrane. This layer has a negative charge, so it actively repels other negatively charged molecules, like large plasma proteins, just bouncing them right back into the blood. And finally, layer 3, the slit diaphragm. This is made of a really critical protein called nephron. It sits right between the foot processes of these podocyte cells and literally acts like a physical sieve, blocking any molecule larger than 7 to 9 nanometers. It is just an incredibly sophisticated piece of biological engineering.
So, why does all this microscopic pressure stuff matter clinically? Let's look at a real-world nursing scenario. Imagine you have a patient who comes in with a huge kidney stone, say bigger than 5 millimeters, and it is completely lodged in their ureter. The fluid has nowhere to go, right? It can't drain, so that urine backs up all the way up the system, right back into the nephron itself. That fluid backup causes a massive spike in capsular hydrostatic pressure inside Bowman's capsule. Essentially, it creates this huge physical pushback against the incoming blood. And that counterpressure completely destroys the delicate net filtration pressure we just talked about, which dangerously drops the patient's GFR and can literally halt filtration altogether.
But what happens when the pressure issue is systemic? Like what if you have severe dehydration or major blood loss? Well, that triggers one of the most beautiful domino effect survival mechanisms in the body, the renin-angiotensin-aldosterone system, or RAS. Here's the cascade. Step 1, your whole body's blood pressure drops. Step 2, these specialized pressure-sensing juxtaglomerular cells in your kidneys notice the drop instantly and release an enzyme called renin into the bloodstream. Step 3, renin bumps into a liver protein called angiotensinogen and converts it into angiotensin 1. Step 4, another enzyme called ACE comes along and converts angiotensin 1 into the ridiculously powerful angiotensin 2. And finally, step 5, angiotensin 2 tells the adrenal cortex to release aldosterone and tells the pituitary gland to release antidiuretic hormone, or ADH.
So, the real magic is how these hormones actually step in to save the patient's life by fixing that low blood pressure. Think of angiotensin 2 as the body's ultimate alarm bell. First, it causes massive systemic vasoconstriction, just clamping down hard on your blood vessels to immediately squeeze your blood pressure back up. Second, it triggers aldosterone, which commands the kidneys to hold on to sodium. And as we know in healthcare, where sodium goes, water naturally follows. Third, it triggers ADH, which actually inserts special water channels into the collecting ducts, actively pulling water out of the urine and back into the blood to save fluid. And lastly, it cranks up the thirst mechanism in your brain so you drink more. Together, these effects successfully bump up your blood volume and raise your blood pressure back into the safe zone, restoring your homeostasis.
Wow, we have covered a massive journey today, haven't we? All the way from the macroanatomy of the urinary tract down to the microscopic slit diaphragms of the nephron and finishing up with the life-saving cascades of the RAAS system. The human kidney is, without a doubt, an absolute engineering marvel. So, knowing that your kidneys are tirelessly filtering 180 liters of fluid every single day just to keep your body's delicate acid base, electrolyte, and fluid levels in perfect check, what steps are you going to take to protect these incredible organs? Drink your water, mind your blood pressure, and keep exploring the fascinating world of human physiology. We'll catch you on the next explainer.